Povidone iodine hand scrub is a solution used for surgical hand preparation before medical procedures, particularly surgeries. It contains povidone iodine 5 to 10%, which is an antiseptic agent known for its broad-spectrum activity against various microorganisms, including bacteria, viruses, and fungi. The hand scrub helps reduce the risk of infections by effectively killing or inhibiting the growth of these microorganisms on the hands and forearms of healthcare professionals. The povidone iodine hand scrub is used to cleanse and disinfect the hands and forearms of surgical team members before entering the sterile environment of an operating room. This helps maintain a high level of cleanliness and reduces the potential for introducing harmful microorganisms into the surgical site. The hand scrub procedure typically involves washing the hands and forearms with a povidone iodine solution, followed by thorough rinsing and drying. The specifics of the procedure may vary based on the healthcare facility's protocols and the type of surgery being performed. It's important to follow the recommended guidelines and procedures for using povidone iodine hand scrub to ensure its effectiveness in preventing infections during surgical procedures. Always consult your healthcare facility's guidelines and the manufacturer's instructions when using povidone iodine or any other antiseptic solutions.